So now let's talk about each group of nuclei separately. So the first one is the sensory nuclei. The sensory nuclei are the ventral posterior nucleus. You can see it in this coronal section. So this is the ventral nuclei. It's made of the ventral posterior lateral and ventral posterior medial. So this is the third ventricle there. So we start from this diagram. There is two different nuclei and they're receiving different information. So the VPM is receiving information from the anterior trigeminal thalamic tract, and if you remember that this is part of the trigeminal nerve, and that is receiving pain and temperature information. The trigeminal lemniscus is also part of the trigeminal nerve, and that is, carrying tactile information, proprioception, and vibration to thalamus. And from the thalamus, from VPM of thalamus, it goes to the somatosensory cortex. The other one, so this is a smaller area that's located in the face, part of the trigeminal nerve, and the rest of the body is coming from these two areas. So one is spinothalamic, and that is important for pain and temperature, that is coming from upper limbs, lower limbs, body walls. And the other one is the posterior column medial lemniscus, and that is carrying fine touch, vibration, position, and proprioception. And they go to the VPL, and from VPL it goes to the somatosensory cortex. So this area, this image is explaining the same thing. So you have the peripheral information, spinothalamic and posterior column medial lemniscus information from most of the body that is goes to VPL, and information from the face goes to the VPM through the anterior trigeminal thalamic and trigeminal lemniscus. It goes to thalamus, processed there, and important information is then sent to the cortex of the brain. So this is the central sulcus, and this is the postcentral gyrus, and that is the primary sensory cortex. And this is the area that is responsible for conscious understanding of the sensory stimuli. And this table is explaining the same thing, it's just in a different format. So this is relay nuclei. These are the sensory relay nuclei, VPL and VPM. The VPL is getting information from the dorsal column medial lemniscus and an anterolateral system. The spinothalamic is part of the anterolateral system, and that goes to somatosensory cortex. And from the face, there's two different tracts, trigeminal lemniscus and anterior trigeminal thalamic tract, and that's because the different sensory stimuli are sent from the face through these two tracts, and that goes also in the same area, somatosensory cortex. Then is still we are in the relay nucleus, and we are in the sensory relay nucleus. These are the special sensory, so geniculate nuclei. One is the medial geniculate nucleus, and the other one is the lateral geniculate nucleus. So starting with the auditory system, so there are hair cells, and then that goes to, that is in the cochlea, and that goes to the spiral ganglion, which is not shown here. If you want to write it, you can write it, the spiral ganglion. From there, it goes through the cochlear nerve to the cochlear nuclei, through the cochlear nerve to cochlear nuclei, and from there it goes through the lateral lemniscus to the inferior colliculus. Inferior colliculus, if you remember, is in the midbrain, and from there it goes to the medial geniculate nucleus of thalamus through the inferior brachium. And from thalamus, it goes to the primary and auditory association cortices. The visual information is in the retina and the eyes, and from there it goes to optic nerve. So if you want to write it here, optic nerve, optic chiasm here. And when we get to the visual system, you can understand the more details of that. So optic nerve, optic chiasm with CH, and then is the optic tract, and from there it goes to the lateral geniculate nucleus, and through from here it goes to the cortex of the brain, primary visual cortex and visual association cortex. That is through the optic radiation. Optic radiation. Okay, so that's the name if you want to write it. And this diagram is explaining the same thing, but just like in a diagram format. So you can see that information is coming from the eyes, going through the optic nerve and optic tract, and then it goes to the lateral geniculate nucleus, and finally ends up in the occipital lobe, which is, this is the primary visual cortex. These areas are visual association area. And the auditory information, it is going to the spiral ganglion and the cochlear nuclei, and then inferior colliculus. From there it goes to the medial geniculate nucleus of thalamus, and from there it goes to the primary auditory cortex, auditory association area, and that is in the temporal lobe.